Hi, I'm Joe Flower. I've been doing this a really long time. I've been thinking about healthcare, writing about healthcare for almost 30 years. I've been talking to thousands of doctors, nurses, people who run healthcare institutions. I've visited hundreds of hospitals in every state of the Union, all across Canada, in Europe and other parts of the world. Now I am out there speaking because there's a particular thing I have to say. A little bit of news, actually, for most people. This is the news. We can fix healthcare. We can make it work for all of us. Won't be easy, but we finally have the tools to do it. You know, for a long time, I didn't think I understood healthcare very well. I did a lot of work out there talking about new pharmaceuticals, new gadgets, new devices, about building healthy communities, about computers and internet and healthcare. Fascinating stuff. But when it got down to the core, how the whole thing was organized, and why it worked so poorly, and what we could do to make it better, I had kind of a despair, really. Kind of a feeling that not only couldn't I understand it, but that nobody probably could. It was such a mess. The bottom line of it is very simple. That we spend vast sums on healthcare in the United States, more than anybody else in the world, by far. And yet, our results are actually worse than any other developed country. You know, it's practically un-American. We have this little saying in this country, you get what you pay for. Do you get what you pay for in healthcare? How would you know? How would you even begin to answer that question? It's actually a very important thought. For some very simple reasons. We all have bodies. And we have moms and dads, kids, spouses, mates, friends. And we all have a checkbook. And healthcare threatens to bankrupt many of us. You know, the last few years, though, something changed for me. Something clicked. I realized I had to get deeper and wider to think about healthcare. I had to go back to all the studies I'd done about how all kinds of systems worked. Back to the writing I'd done about the aging of America, about changes in China and Japan, changes in American business, changes in the technological scene. I began to see that if you shifted your point of view just slightly, if you began to see things a little bit differently, put on a little bit different lenses, you actually could see that the answers to healthcare are all around us. They're in what those other countries do about healthcare. They're in what the other industries have done about all kinds of changes, and they're in these new technologies, especially in the new technologies that have to do with information. For this basic reason, these things are just coming to their full potential, and finally we're getting to the place where we can ask some basic questions about healthcare, like what works, what doesn't, what's efficient, what's effective, are there things we should be doing that we're not doing, what are we doing now that we may as well not be doing? In other words, if we harness these new technologies, and there are ways to harness them, to find out these facts, we could do a little shift in the rules here, a change in the structure there, and before you know it, you'd be getting what you pay for in healthcare. What a revelation. What a possibility. And the other strange thing was I started hearing voices from across healthcare, from this institute and that pilot project and this paper and this publication, that other people were beginning to see things differently too. You know, it's a small movement so far, but it's a movement. I like to call it healthcare better, faster, cheaper. That is healthcare for everyone, there when you need it, guaranteed, top quality, and actually less expensive than what we pay today. That's why I'm out there talking about it. Because if we're going to change this, it's going to take everyone seeing it a little bit differently. not just politicians and legislators, regulators, people who run healthcare, people who run pharmaceutical companies, health plans, doctors, nurses, administrators, but also everyday people, also families, patients, voters, citizens. We all need to have that little bit of shift. Now, for you and your organization, this may not be the right thing. Maybe this isn't the time for you to think about change. But if you have the feeling that your organization is ready to step forward and to say, what is it we really need to do about the changing landscape of healthcare to prepare for this future, to really take our part in this? Let's talk. This talk may be exactly what you need to get your organization going. Give me a call. Talk to me. I'm Joe Flower. Thank you very much.